Some patients experience difficulty in eating food due to multiple tooth loss and impaired chewing from both sides. On other side, they are also suffering from prolonged tooth loss due to other medical conditions like osteoporosis, uncontrolled diabetes, periodontal diseases, etc. And they experience weak oral bones, lack of bone density, narrow width, and reduced bone height. This type of conditions in dental and medical terminology called as atrophic jaw, in which we can notice the resorption of maxillary or mandibular upper or lower alveolar ridge. In this type of cases, we are using advanced techniques with an immediate load concept and placing single piece Swiss made corticobasal implants under local anesthesia. With these, we can provide implant supported fixed teeth within 3 to 5 days, and with that, patient can chew food properly from both sides.